Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Wednesday, March 31st. I'd like to remind our listeners before we begin that these COVID-19 updates will look slightly different over the coming weeks during the election period. Dr. Hanley will provide any case updates and will focus in on technical aspects of COVID. He will also use the opportunity to respond to questions that we may receive about the week's pre-identified topics. This week, Dr. Hanley is joined by Nicole Morgan, the Deputy Minister of Education, who will address the return to full-time classes for grades 10 through 12. Sign language interpretation will be provided by Mary Thiessen, and French language translation will be provided by André Boursier. The Q&A format will remain the same. We will call reporters by name, and each will have 2 questions. Before we begin, I would like to verify that everyone can hear us. If any of the reporters are having a problem, please email ecoinfo@yukon.ca. Dr. Hanley?
Thank you, Pat. Good morning. Bonjour tout le monde. There's lots of positive news to share today, but as always with COVID-19, we need to keep vigilant and check in with the facts and the risks as we know them. Just a week ago, I talked about variants and the risk they posed for Yukon. It was only the next day that we announced 2 imported cases of variants, and over the last week we have witnessed in most of the provinces what has been predicted, a surge in cases largely linked to the B117 variant. The 2 cases here, one a Yukoner and one a non-resident, are doing well, and we have had no further cases or exposures associated with these cases. These individuals did the right thing and did not spread the infection. As B117 and potentially other variants of concern take over from the traditional COVID-19 virus, we know that cases here were inevitable, and we will see more introductions of this virus. We need to stay on top of this. We are still at risk as variant cases surge in Canada, and if we let our guard down, a variant COVID could easily take hold, spread, and cause 1 or more outbreaks. There's also an important added menace posed by the variants. Younger adults are at higher risk for more severe outcomes with variants compared to traditional COVID. More and more adults in their 50s, 40s, even 30s are getting hospitalized, transferred into intensive care, and dying. As our elders are getting more protected with high vaccine uptake, the toll of COVID-19 and its variants is being felt amongst our younger populations. For now, continuing to follow the Safe 6 carefully and wearing masks in indoor public spaces is essential. Wash your hands, wear a mask, keep your 2 meters distance from others, not in your bubble. If you are sick, please isolate yourself and arrange for testing. And if you haven't gotten your vaccine, please do so. It is now more important than ever to get vaccinated. Remember, the presence of variants in the territory is not as important as whether we allow them to spread. We are fortunate that just because we have cases of the COVID variant here in Yukon does not mean we have to rush to make changes to the current health measures. We know what we each need to do to help stop the spread of COVID, variant or not. The ingredients may be different, but the recipe is the same. By staying on our game, we can ride out the threat that the current 3rd wave in Canada is posing for us and get to the other side, finally, when we can look forward to much better days. I know we are all tired of living through this pandemic, even though in Yukon we have been spared many of the harsh and prolonged measures that other Canadians have had to tolerate. We can only feel for our friends and neighbours in BC who once again have to face the strict measures of a 3-week circuit breaker. I would like to keep us free from having to do anything like that. All the same, this COVID-19 pandemic right now seems like a long winter that just refuses to leave without a fight. But just as spring and summer will be here in a matter of weeks, so will the other side of this pandemic. We are so close. The great news is that so far, the Moderna vaccine is effective against the B117 variant, although when it comes to other variants, the evidence is not yet as clear. So this is the time for us to keep plugging away at vaccine. If you haven't yet, it is time for you to roll up your sleeve and get the protection that the vaccine offers. In vaccine news, as of Tuesday, 67% of eligible Yukoners have now received their first shot. We are in an enviable position, and I hope we can keep up the momentum. Vaccines are our best shot of protection against COVID-19. If we break down the numbers, as of March 29th, 2 days ago, here is what we're seeing. You'll note that with every increase in the age group, the uptake of vaccine rises quite dramatically. In the 18 to 29-year-old age group, 51%. In the 30 to 39 age group, 61%. 40 to 49, 67%. 50 to 59, 70%. 60 to 69, 78%. And the winners are 70 plus, 87%. If we compare to just a week ago, we can see that the uptake is increasing slightly more in the younger age groups, while it has essentially plateaued in the older groups. This is encouraging and makes me optimistic that we can still get to a goal for 75% or more across the board. But right now, there are easily enough susceptible adults, let alone children, to allow for circulation of virus and outbreaks. Now, compare the lower rates of vaccine uptake amongst younger adults to what I mentioned earlier. Younger people are getting more sick, and we are seeing ICUs in hospitals in the southern province with multiple patients in their 50s, 40s, and even 30s. More than ever, we're reminded that no one is immune to COVID-19, as we have seen with the recent studies and research being released on variants. Just being a healthy young adult does not offer enough protection against variants of concern. And it's not just the acute illness that we need to be aware of. Increasingly, we see that COVID-19 can cause long-term effects that may prevent daily life from being what it once was before COVID-19. It's a virus that has no preference in whom it chooses to infect. We have seen just how aggressive it can be, and again, our best method of protection right now is vaccination. Looking at our own data, compare our vaccine by age numbers to those who have been infected. The average age of Yukoners infected with COVID-19 is 33 years old. With the median age, that means half are below this age and half above, 29 years old. Close to half our cases overall are between 20 and 39 years old, the same age groups with the lower uptake of vaccine. That means it is not, it never was, and especially is not now, an old person's disease. Even though most young people do well, some people will not, and younger people are more frequently infected. So while I'm happy to see the vaccine numbers slowly increase, we still need a lot more to step up. Recognizing that younger individuals may lead very busy lives, have children, work, maybe multiple jobs, and commitments that may make it hard for them to make and keep an appointment, we are still welcoming drop-ins at the Mass Clinic in the Convention Centre in Whitehorse. The third round of vaccine visits in the communities is currently taking place, and we will have updated regional numbers to share after that round is complete. Getting that first dose is critical, but so is completing the vaccine schedule. As the general population begins to book and receive their second doses, I have heard people asking, why get the second dose when the first offers enough protection? The first dose is certainly a great start, but you need to be fully immunized. The second dose acts as an immune booster to have a more robust and longer-lasting effect than if you were just to receive the first. It ensures that your body is prepared with the best possible protection if it is to come into contact with COVID-19. people have also commented that if they're going to have a serious reaction, they aren't going to bother to get the second shot because they don't want to get sick. While getting side effects is not pleasant for anyone, even though most of the time the effects are minor, but at least that fever or those aching muscles are an indication that the vaccine is doing its job. Some people just have a stronger reaction than others. Overall, it's not an easy message to take. Just hang in there and get vaccinated and stay tuned. But that is the reality we are in just for these few weeks. We will, in the weeks ahead, be able to talk about what to look forward to, especially with vaccine, and hopefully with an end to the current surge in the south. As we look forward to Easter long weekend, it's a good time to remind people that we all need to keep following the Safe 6+ masking. If you're planning a trip to the pass or relishing some mild days on the ski slopes, or just hanging out with loved ones, think about how fortunate we are here to have so much choice of activities and places to go. Please remember, though, to treat this gift with respect. Respect the gathering guidelines and follow the Safe 6+1 to make it a great Easter weekend for all. A final word about testing. Testing for COVID-19 remains an important part of our response against COVID-19 and the variants. And I can't stress enough the need to seek testing if you have any symptoms. It is easy to convince ourselves that it's a cold or an allergy and it's not COVID. But without a negative test in hand, you really can't know for sure. We have just begun a new social media campaign reminding people of exactly that. Cough, cold, sore throat, even a hangover can all be presenting symptoms of COVID-19. We don't know for sure, and we all have a responsibility to not only take care of ourselves if we're sick, but also to protect those around us. So if you have any symptoms, make sure you self-isolate and arrange to get tested. And we continue to get a rapid turnaround of results. Earlier this month, the return to full-time classes for students in grades 10 to 12 through 12 in Whitehorse was announced. And we're very happy to bring you some more details about how and when this return will occur. When kids in other places are having to return to online learning, we are fortunate to be moving in a more positive direction. So I'll now pass the baton to the Deputy Minister of Education, Nicole Morgan, to provide an update on students in grades 10 to 12 returning to in-class learning full-time. Thank you. Masicho. Merci.
Thank you, Dr. Hanley. Good morning, everyone. I'm delighted to be here to talk to you about transitioning all grades 10 to 12 students back to full-time in-class learning here in Whitehorse for the first time since the pandemic hit. From the outset of the pandemic, our goal has always been to ensure as many students can be safely learning in class as possible are doing so. And I know that this year has been extremely challenging for our students, and I want to thank each and every one of them for their resiliency. As Dr. Hanley mentioned, we are fortunate in Yukon that COVID cases numbers have been low, and the vaccine has been steadily rolling out to the general public. It is very encouraging to hear that we are in a position to welcome our most senior students back to full-time in-class learning. I know that many of you have been anxiously awaiting an update, and today I can confirm that grade 10 to 12 students at F.H. Collins, Vanier Catholic, and Porter Creek Secondary Schools will return to full-time in-class learning on Monday, April 19th. Making this transition on this date will allow us to complete the important planning work needed to ensure that school operations are adapted to meet updated K-12 health and safety guidelines for these schools. Over the coming weeks, we will continue working together with the Chief Medical Officer of Health and school administrators and their school councils to plan updates to school operational plans and scheduling for students. We will also be working to provide additional information to students, families, and working with our partners in education, including the Yukon Teachers Association and Yukon First Nation governments, to hear their feedback and questions. While I am providing this update today, there is still much planning work that needs to occur to determine more specific details about what this transition will look like. This includes working with school administrators and school staff who have just returned to school this week after March break. I would like to take the opportunity today to answer some of the key questions that we've heard from students, families, and our school staff. Timing is a question on the minds of many students and families, wondering why we are bringing students back to full-time in-class learning so late in the school year. We know that many students, families, and school staff have adjusted their daily routines to fit this current schedule of learning. And from the outset of the pandemic, our goal has always been to ensure as many students can be learning in class full-time as safely as it is possible. We know that students learn better when they are in school and they have the support of their teachers, their classmates, and their friends. By bringing students back to school at this time, we will be able to provide approximately 90 hours of face-to-face instruction, and this is a significant and meaningful opportunity to address any learning gaps. We are also aware of the social elements of being at school and the impact it has on the positive mental health and wellness of young people. Throughout the pandemic, we have based our decision-making on the recommendations of Yukon's Chief Medical Officer of Health, and this decision is no different. With vaccination rates increasing, case counts remaining low, Dr. Hanley has indicated we are in a position where it is safe to welcome these students back full-time. The risks are very low and outweigh the risks of keeping students out of school full-time. And as those responsible for providing kindergarten to grade 12 education in Yukon, we have a responsibility to provide the best programming and learning opportunities that we can for all our students. We recognize that some students are succeeding on the half-day in-class schedule, perhaps finding ways to have valuable work experiences. We also know that there are a number of parents and guardians who are worried about the impact this schedule has had on their child's learning. Our second Learning During COVID-19 survey, many parents, students, and school staff identified that this half-day in-class schedule has negatively impacted student learning and that more teacher support is needed. We know there will be some adjustments, but there are many benefits to returning these students to in-class full-time learning. For example, this transition provides students with greater access to in-person support from their teachers, especially in learning areas where they may be struggling. It creates more opportunities for teachers to work with students to ensure that they are earning credits that they need to graduate, and it provides students with opportunities to return to more familiar school routines ahead of the next school year. It also allows our graduating students to reconnect with friends and teachers to finish off their school year as they would have expected in a normal school year. Many students and families may be wondering if this transition is going to have an impact on current course schedules and timetables. And we have been in discussion with school principals, and I want to confirm that students will continue with the courses they are already taking to finish this school year. It does mean, however, that some adjustments will need to be made to student timetables. As part of our planning work, we will be working with school administrators to determine what kinds of adjustments need to be made. And in doing this, our goal is to make the transition as least disruptive as possible so students can stay focused on learning and we can ensure they have the supports that they need. We have also heard from families asking if this change will impact the F.H. Collins grade 8 students who are currently attending at Wood Street Center. I want to confirm that this transition does not impact those students. F.H. Collins grade 8 students will remain at the Wood Street Centre for the remainder of this school year. We've heard from families who are asking about the impact to busing. We recognize that some adjustments will need to be made to the current busing schedule, and we are working with our operations team to identify those changes, and we will be updating families as soon as we have more details. Student employment is another concern that we have heard from some students who have picked up jobs while on the current schedule, and they wish to maintain this employment. We have heard some express concern that returning to full-time in-class learning will disrupt these opportunities. And I want to clarify that while students have only been required to attend in-person classes for half the school day, it has always been the expectation that students would continue to complete the other half of their learning day away from school. I recognize that some students have been able to find a balance between completing their schoolwork on their own time and finding opportunities within the flexibility this schedule has created. However, it has always been our goal to return students to full-time in-class learning as soon as it is safe to do so. And while we know many students have found success on this schedule, there are still many others who are struggling. We know there will be some adjustments, but we have a responsibility to take the steps we can to ensure all students are supported and successful in their learning. We have the opportunity to improve access to in-person teacher support, and we are confident this transition will provide overall benefits to students. To our teachers, I know they are anxiously awaiting to hear whether or not they will have time to prepare for this transition during normal school hours. Teachers and school staff have been on the front lines of supporting Yukon students throughout this pandemic. They have done a tremendous job adapting their practice to accommodate students. I understand this has not been easy, and I want to thank all of our teachers and school staff for their incredible resiliency and creativity throughout this school year. I know you are wondering if you will be allocated time and support for planning for this transition, and I want to confirm that we are scheduling 2 school days where these school administrators and teachers of grades 10 to 12 students will be able to focus solely on planning for the remainder of the school year. These 2 days are scheduled for Thursday, April the 15th, and Friday, April the 16th. During these 2 days, grades 10 to 12 students will not attend classes at school, but they will be asked to complete 2 days of learning from home. These 2 additional days will provide focused time for school administrators, teachers, and school staff to identify any needed adjustments to course plans and timetables. While I have tried to address some of the questions around planning and impacts to programming, I also want to address planning around health and safety. The health and safety of students and staff and communities continues to be our first priority. From the outset of the pandemic, we have followed the recommendations from Dr. Hanley and his staff. With vaccination rates increasing, low case counts, Dr. Hanley has indicated that we are in a position to welcome these students back to full-time learning in class and has provided health and safety guidance for us to do so via updated health and safety guidelines. These updated health and safety guidelines will inform our work with school administrators and school councils to adjust operational plans to ensure we continue to keep students, staff, and communities safe. Dr. Hanley's guidance will allow us to be more flexible in cases where physical distancing is more challenging. While there will be adjustments to school operational plans for these 3 Whitehorse High schools, the other schools will continue to follow their current operational plans. And while some of the physical distancing requirements will be relaxed at these 3 schools, we continue to expect all school staff students and visitors to schools to stay at home when sick or showing symptoms, practice proper hand hygiene, maximize physical distancing where possible, use non-medical masks where physical distancing is not possible, and keep groups of students together while limiting mixing as much as possible. This is all part of our overall approach to keeping the risk of COVID-19 low across our territory. Thank you, everyone, for your time today. I hope this has answered some of the questions on the minds of students, staff, and families. We will continue to communicate with you over the coming weeks to keep you updated on this transition. Thank you again, everyone, for patience, kindness, and solidarity as we combine our efforts to ensure the success of all Yukon students.
Thank you, Deputy Morgan. Thank you, Dr. Hanley. We'll now move to the phone lines, and we'll begin with Nick, Canadian Press.
Joining the meeting.
Mario De Ciccio, Radio-Canada.
Nick, are you still with us? Not hearing anything. We'll move to Luke, CKRW.
Hi, I'm curious if there will be encouragement for the students that are going back to school that are 18 years of age, if there's going to be encouragement for them to get vaccinated as soon as possible.
Yeah, certainly. We are, and again, for some time we've had the clinics open for the wider public, and are definitely encouraging, just as in my message today, that we really want to encourage young adults, and that includes 18-year-old adults and kids as they turn 18. And of course, we're paying very close attention to the beginnings of trial results now. So we just saw today that Pfizer, for example, releasing preliminary trial results on the 12 to 15 trial, and so we will expect 12 to 17 trial results from Moderna, probably in the weeks to come as well. So really looking forward to being able to push not only our the accessibility for the existing age brackets, but to be thinking ahead to immunizing our younger people as well.
Do you have a follow-up question?
No, just the one question for me. Thank you.
Thank you. We'll move now to Mario, Radio-Canada.
Hi there. Yes, thank you. My question is actually in French for Dr. Hanley. Monsieur Hanley, si vous pouvez juste nous reparler un peu, je sais que vous l'avez mentionné au début mars, mais qu'est-ce qui fait que maintenant est le bon moment pour retourner en classe?
So the question is for Dr. Hanley. Can you refresh our memory of why you feel that right now is the right time for these higher grades to return to their classroom?
Oui, merci pour la question. C'est, à mon avis, après avoir entendu les questions, les demandes, les narratifs des parents, du fait qu'il y a, comme Madame Morgan a dit, qu'il y a les étudiants qui trouvent des problèmes avec la structure courante. Et donc c'est une question de, comme toujours, on essaie de balancer les risques, d'avoir les mesures en place pour empêcher la propagation de virus, de COVID, mais en reconnaissance au même temps des effets secondaires. Et donc, de toujours essayer de rebalancer les risques. Donc, comme on a on a fait très bien, mais au même temps, on entend que c'est pas évident pour beaucoup des étudiants. Il y a toujours assez de temps pour changer la routine, pour mettre en place des mesures en toute sécurité pour donner l'opportunité pour les étudiants d'apprendre plein temps dans les classes. Donc, je pense aussi c'est un bon moyen. On est dans le printemps maintenant. Avec chaque semaine, on a plus des opportunités pour ouvrir les fenêtres, pour aller dehors, pour participer dans les activités dehors. C'est aussi un bon moment pour essayer, pour répéter en fait le plan possible pour le retour plein temps pour le mois de septembre. Donc c'est un moment pour repositionner. Et c'est aussi avec toutes les autres raisons que Mme Morgan a parlé tout à l'heure.
In English?
Really, essentially saying, just to repeat in English, because there are a couple of aspects I described in French, really just going over the rationale. But from my point of view, I think it was a matter, we're always trying to strike that balance between COVID prevention and recognition of anything we do in COVID prevention has secondary effects. So how do we always try to restrike that balance between sound prevention and prevention of those possible effects, whether they're on mental health, in this case on learning ability, and having heard more and more concerns that some students are finding it difficult, as the Deputy Minister described, that we need to respond to those concerns and to give a chance for students to get together for the last 2 months, that's 90 days of learning, to really restore some of that ability to get back into a face-to-face learning environment. And from my point of view, it's also we're in spring. Doors and windows are, we're not quite in spring. I'll have to correct myself, but we're getting towards spring. And so we are getting towards that time when more and more activities can be outside. The windows can be open. We can increase ventilation. We can so we can modify more easily the environment, and we've practiced this. We've had now all of this school year to practice the routines and to take on these this added ability to take in the students and to do it well. So I'm very confident that this is good timing. And the other aspect is that it does help us to get in to learn how to do this in preparation for a full school year next year. So I think much better to do it now when the risk is low, when we have a fairly short time, when we're getting towards the springtime, to work this out, work out the kinks, and be that much better prepared for a fall return to school with this much this added experience.
Thank you. Une autre question, Mario?
Oui, actually, just a quick question about the variant that we have in the Yukon. Was it ever confirmed what? I know one of the cases, the case that was not from a Yukoner, was we named the variant, but was the variant of the case in Yukon ever confirmed?
That's right. No, we don't have the actual confirmation. So we had the screen positive variant. The screen positive is what BC does now with they're looking for that gene deletion, which signifies a variant, but we don't have the final sequencing information as yet to confirm that it's a B117 variant, as we suspect, but it still could be another variant that shares that gene deletion.
Thank you. We'll move to Haley, Yukon News.
No questions. Thank you.
Thank you. Tim, Whitehorse Star.
Yes, good morning. My question is probably directed more to the Deputy Minister. I'm just curious as to why the students are going back to school pretty much a full 3 weeks later than originally scheduled. Was there not a template or a model of a plan to take them back that just needed to be tweaked, or did you start from scratch?
Thank you very much for your question, Tim. As I mentioned in my speaking notes, the school staff and administrators, students have been on spring break for 2 weeks in that time period. And so that is a time for them where they are not working. And so we met with them before spring break to talk about what work we needed to get started. And while our school staff were on their break, we continued to work with Dr. Hanley's staff on finalizing health and safety guidelines, of which are being provided to these schools today. And now the schools begin the work locally with the families and also with students to start to put together more detail around what those operational plans will look like.
Thank you. Do you have a follow-up, Tim?
Yes, because I don't think my question was really answered there. Was there some kind of framework in place? You've had almost a full school year to plan how to go back to school if it was announced. Was there something in place, or did you start from scratch?
Again, thank you for your question. In terms of a framework, we have provided the Learning During COVID-19 framework, which shows the range of risk and different configurations for schools during a pandemic. And so we continue to be in the low risk to COVID-19 section of that framework. And what is happening now is we continue to follow health and safety guidelines. There's two pieces of that framework, the health and safety guidelines and the continuity of learning. And both of those have now been updated for these three schools. So we're following the framework, and that time period since the last announcement has been specific updates to those two guiding documents that inform the framework.
Thank you. We'll move now to Chris, CBC.
Hi, thank you. I guess another question for Deputy Minister Morgan. I guess I'm curious to know, probably for some students, the news that full-time classes will resume is not good news for whatever reason. Will students be able to opt out of returning to full-time classes if they feel that they need to?
Again, thank you for that question. That's a really good question, and certainly one that we hear fairly often. So the announcement today is that we are returning students back to full-time in-class learning, and that is what teachers are now going to get underway and start to put together what those plans look like. As we do in normal times, we always work with students and their families to address whatever individual circumstances that they have and work within the expectations of how the curriculum is being delivered. So those conversations will continue at the school level, but the expectation is that students are returning to full-time in-class learning.
Do you have a follow-up, Chris?
Yeah, I guess, I have a sort of a two-part follow-up. I guess I'm not fully sure what the answer means, honestly. I mean, can students opt out if, for some reason that makes sense to both administrators and the students, if they feel like they need to? And then the second part of that is, you did mention a survey and just gauging student, response to these half-day classes. Can you tell us, what proportion of students have said that they struggled with the half-time classes?
Absolutely, yeah. And thank you for that question, because I think it is really important to touch base back to the Learning During COVID-19 survey. So first I'll start with the survey and then I'll answer your first question. I made a note of it there. Learning during COVID-19 surveys, we've conducted 2 of them so far through the school year, and we developed those surveys with partners in education. We work with the Teachers Association, school councils, First Nations. And the second survey that we did, we asked some questions about this current school year and about the half-day schedule in particular. And many students, parents, and school staff identified that this half-day schedule is impacting student learning. 51% of grades 10 to 12 students and 69% of their parents responded to the survey and said that increased teacher support would be most helpful to them to be successful in their learning. And similarly, 48% of grades 10 to 12 students and 69% of their parents that responded to the survey said that the learning schedule was negatively impacting their learning. And I think that's, for me, something that's important for us to keep in mind, that there isn't one answer that's going to work for all students. Students and families all have a very different and varied contexts in which they live their lives and the impacts of the pandemic on their particular circumstances. And students all have very diverse ranges of learning and learning needs. And so, to try and be as specific as possible, the expectation is that all students, teachers will be preparing for all students to be in class full-time for their learning. That does not mean that schools are inflexible and do not work with students and families. They absolutely, even in normal times, do that work, and they'll have those conversations of what supports are needed for those families and students that are unable, for various reasons, to return to full-time in-class learning.
Thank you. We'll move to Laura Boreal.
No questions, thanks.
Thank you. And I will just check back. Nick, Canadian Press, are you still with us?
I am, but no questions.
Thank you very much, Nick. Excuse me. I'd like to thank everyone for their time today and advise that the next COVID-19 update will be April 7th at 10:30 a.m. Next week's technical topic will be based on COVID-19 testing, including the pros and cons of rapid testing, along with updated info on vaccines and variants. If you have questions, please email hss@yukon.ca or post a question to the HSS Facebook page. Thank you.